sector is doing to both keep their staff safe and also ensure that those they care for, those who rely on them, are still also being taken care of. So again, I am sincerely appreciative of all the work that everyone is doing. I know these are challenging times, and please know that we are here at Safecare BC to support you in any way we possibly can, so that we're helping you keep yourself safe and keep your staff safe during these challenging times. Before we get started into the content of today, just a couple housekeeping items. So first off, if you can hear my voice, congratulations, your audio is working. If you are unable to hear me, please let me know. I know Jen Lesage has already messaged this through the text box, but if you cannot hear me speaking right now, please send Jen Lesage a message. Also too, if we could ask people to identify just in the chat box where they're from, what organization you're from, that would be really helpful for us as well. Speaking of the chat function in Zoom, we are, just in the interest of keeping the audio nice and clear, we're asking people to send their questions in using the chat function in Zoom. So you can just type your question in there and we'll do our best to answer it. If we don't get to it, we'll make sure that we follow up with you. In addition to that, I would also ask that if you're experiencing any challenges to throw those in the chat box too, so that we can tackle those today. And I see that there's some folks who are already using the chat function to let us know where they're from. That's greatly appreciated. Thank you very much, everybody. Also too, just so you know, we are recording the call. The chat function will not show up in this call, but we're recording it so that people who are unable to join us today are able to listen in on the audio at a later time. So again, I encourage you to pop your questions in into the chat box. I'll do my best to address them as we go, and we'll get started. So once again, thank you everybody for joining us again. I know these are not normal times. They're challenging for everyone, and so really appreciative of the work that you're doing. A little bit about Safecare BC. So Safecare BC is the Workplace Health and Safety Association for the continuing care sector. And what that means is that if you are registered with WorkSafe BC as a home care or community health support services provider, you are automatically a member of Safecare BC. If you don't fall into this category and you want to become a member, we actually also have a mechanism for you to do that as well, but I'll talk about that a little bit later. And so again, our focus on workplace health and safety and our involvement with regards to the issue around COVID-19 really stretches back to mid-January. So we know that this issue first started taking shape in Wuhan, China, back in, best guess now is back in as early as November of last year. It wasn't until late January that the first case showed up in BC, but we were monitoring the situation quite closely over the winter months, seeing what was going to happen. Once that first case popped up in BC, we got in touch immediately with the Ministry of Health and the Provincial Health Officer to determine what the implications are for the continuing care sector. Fast forward to today, we've been very active on this front, working to be as responsive as we can to the needs of the sector, and also working to anticipate as best we can any future challenges that might be coming down the pipe. So that's why exercises like today are so valuable, because it provides us with an opportunity to give you guys some information, but also to hear from you what challenges you're starting to see, because we want to be in a position where we're being as proactive as possible. And that includes looking at some pretty creative solutions to address two of the most pressing issues that we're aware of right now. One of them being the access to personal protective equipment, so things like gloves, masks, hand sanitizer, and also too, being very proactive in addressing any potential staffing shortages we may see as a result of this. And we are already hearing reports that organizations are starting to see the implications of the recommendations coming out from the Provincial Health Officer's Office impacting their staffing complement. So I'll get to a little bit more about that in a second, but what I wanted to do is, first of all, walk you through some of the resources that we have right now for you on COVID-19, and also provide you with a bit of a background in terms of what COVID-19 is, what we know, what we don't know, and some basic precautions you can take in your own organization to keep your staff safe and by extension, keep your clients safe. So again, this is focused for home care. So if we have folks on the line today who are not from home care, rest assured, we will be getting some more sector-specific information out to you as well. But for today, our focus is going to be on the home care sector. So for those of you who can see my screen right now, what I have up is our Safecare BC homepage, so safecarebc.ca. And the reason why I'm going to direct you to this is we got a lot of good information out there right now about COVID-19 and the basics, but I'll walk you through it. So you go to our homepage, you click on the Learn More button under the safecarebc.ca, and you'll be taken to our landing page on COVID-19. So the latest, as of yesterday, we had 186 cases of COVID-19 in BC. Some of those cases have made a complete recovery. That number will probably increase because they're just waiting on those test results to determine that. We have unfortunately also had a number of people pass away from the disease. The majority of the cases with COVID-19 are mild, and there are now cases of individuals coming forward who are asymptomatic but testing positive for COVID-19. However, we are seeing that among those who are older, so the elderly, and those with underlying health conditions experiencing a higher rate of complications from COVID-19. So that's why our sector, the continuing care sector, comes into such sharp focus because of the nature of the clients that the sector works with. But also too, we need to take into consideration our staff members who may fit into those categories as well. And again, thinking about it from a workplace health and safety standpoint, ensuring that we're doing all that we can to keep our staff safe. So this webpage, we are updating on a daily basis and sometimes more frequently as the need arises. A couple of the questions that we're getting, we have an opportunity for everyone who's interested to submit questions. So if you have a question, you can ask us directly using the web form on our website. And of course, today's your opportunity to ask questions using the chat functions too. But just to give a little bit of background around COVID-19, COVID-19 is a coronavirus. And so that's a family of viruses. It includes everything from things like the Middle East Respiratory Syndrome, as well as SARS. The newest virus on the scene, of course, is COVID-19. The big question around this virus is how it is transmitted. And so this factors into when you're making those decisions around the protocols and the equipment you're putting in place to keep your staff safe. So the best evidence to date indicates that COVID-19 is spread through droplets and close contact. And that has some important implications for how your staff are going to be protected in this situation. There is, to date, no evidence of airborne transmission. However, there are some added layers of precaution that are needed when healthcare workers or continuing care workers are engaging in something called aerosol generating medical procedures. And I'll get to that in a second in terms of what that means exactly. But let's start with that. So one of the questions that we get asked quite a bit right now is that question around what is an appropriate level of personal protective equipment for folks who are going to be providing care. And so again, we have a lot of great resources on our website, but the one thing that I'll direct you to is that piece around the personal protective equipment. So the World Health Organization has got a fantastic resource out on the rational use of personal protective equipment for COVID-19. We do also have some more BC specific ones that we're working on as well. One thing I will point out with the WHO's resource is that it uses a different measure of social distancing. So that's just one thing to keep in mind, but I'll talk about that in a second. So from a BC standpoint, if you have a home care worker who's going to provide care to someone who is either a suspected or a confirmed case of COVID-19, here's what they need. They need gloves. They need an isolation gown. they need eye protection, and they need a surgical or medical procedure mask. So eye protection, surgical mask or medical procedure mask, gloves, and isolation gown. That's for most cases. The only time a respirator is required, so for example, an N95 mask, is when you're engaging in aerosol generating medical procedures. That's things like using nebulizers or performing CPR, suctioning of airways, intubation, that sort of thing. So those are not typical practices that you would normally see in a home care setting. However, I mention them because there may be some extraordinary circumstances, for example, CPR, where you may need to have those resources on hand. But for the vast majority of the interactions you're going to be having at a home care level, it's going to be the contact and droplet precautions. So again, eye protection, medical procedure mask, isolation gown, gloves. That's for folks who are going to be interacting with clients within that 2 meter distance. And that's the distance that BC defines as that social distancing measure. So if you're within 2 meters of someone, that's when you need to be taking those extra levels of precaution. I also know that we have folks in our home care and community health support services sector who may not be providing direct care. Maybe you have an office, maybe you provide outreach services to people. So in that case, the current recommendations, again, is if you are maintaining that 2 meter distance between yourself and another person, you're not having direct contact with them, you're not having direct contact with their belongings, the recommendation right now is that you do not, there is no special PPE, personal protective equipment required in those instances. So again, if you're providing that direct client care, what you need are droplet and contact precautions. So a surgical or procedure mask, an isolation gown, gloves, and eye protection. And eye protection can either be like a face shield or goggles, but really what it is just to ensure that there's no risk of splash into the eyes. And that's an important one. And again, when we're talking about folks that are working in an administrative capacity, so administrative tasks that don't involve contact with a client who is suspected or confirmed to have COVID-19, there is no PPE required, so no personal protective equipment required. So that's a piece I want to address right off the bat with regards to the personal protective equipment piece. And again, there's a lot of great resources on our website that speak to it. But there's obviously a lot more that can be done before that. And if you go again to our website and you look on the home care and community support and you click to learn more, we have a number of recommendations around basic measures that can be done to keep your staff and also your clients safe. One of the most basic ones is washing your hands. So ensuring that you're washing your hands for at least 20 seconds. Soap and water is great. If that's not available, alcohol-based hand sanitizer. Obviously, if hands are visibly soiled, they need to be washed with soap and water first. Ensuring that your staff know how to put on and take off the personal protective equipment as well is also really important. And so now is a great time to ensure that if you haven't done those in-services recently, to go ahead and do that. We also have been fielding some questions around the direction to self-isolate for staff who have traveled internationally. There's a little bit of some nuance here for folks who work in healthcare. So the advice that we've received to date is that if you are a healthcare worker, it's deemed an essential service and you are exempt from the 14-day self-isolation period if you've traveled internationally. But what we have been advised is that if your staff members are in that category, of course, if they have symptoms, absolutely do not come to work. And also, during that 14-day period and in general, staff need to be monitoring for symptoms so that at the first sign of a runny nose or a cough or anything to that extent, they need to stay home. The other piece that we've seen just around staff who have traveled recently internationally, current recommendation is for those staff who are currently not showing any symptoms and are reporting to work, that they wear a medical mask when they're around clients, just again to ensure that we're limiting the risk of transmission as much as possible, but also too importantly from a workplace safety standpoint, that they're keeping their distance from their coworkers. And again, we're defining that as that social distance, 2 meters away from folks. Again, there's more measures that can be done from a home care and community health standpoint. If we're talking about those who are, if you're in a manager position, one of the really big things in place here is to ensure that you've also got surveillance mechanisms in place to catch potential cases early. And that might be as simple as having a mechanism where people check in with the clients before they go to their house. Just ask them how they're feeling, if they've got a new or worsening cough, if anybody in their household has come down with any symptoms, so that they're aware as to what's going on and that they can get back in touch with their supervisor to ask for direction. Also to just really being supportive and helping your staff if they identify any situations that are potentially unsafe. Because again, having that proactive two-way communication is going to be really critical here. And then of course, with regards to staff scheduling, I know this is going to be a real challenge for folks, but ensuring that staff are not working when they're sick, because not only are you putting your clients potentially at risk, but your other workers as well. So those are kind of the really big key ones. And of course, ensuring that everybody is aware, clients and their family members and your staff are aware of your organization's policies and the practices around infection prevention and control. So those are kind of the big high-level pieces that we have in terms of information. And again, we've got a lot of great resources linked on our website that you're welcome to connect with. We know that one of the questions we've been fielding a lot is just around how can people assess for symptoms of COVID-19. There's a great new self-assessment tool that's been launched by the BC CDC recently, and that is linked on our website as well. Anyone can go and click on it. It'll run through a series of questions. We also have some great resources on things like hand washing practices, and then information on donning and removing personal protective equipment and the like. So again, lots of great resources out there, and that's what, and we really encourage you to take advantage of those. To let you know about a couple of the key issues that we're working on right now from a larger standpoint, we are very active on the issues around personal protective equipment and staffing. And if you are experiencing any issues, any critical shortages, so that means you only have 3 days worth of stock, we really encourage you to get in touch with us. So if you are looking at only having 3 days worth of medical masks, 3 days worth of hand sanitizer, what have you, please get in touch with us to flag it for us so that we can continue our work. We are in daily contact now with the Ministry of Health provincially, and we have now been in contact with the Federal Ministry of Health, raising these issues around personal protective equipment and access to supplies, as well as the potential implications for staffing shortages. And that's one final piece that I want to touch on before we open it up to questions, is around that issue of staffing shortages. One of the things that we're looking at right now is we may be seeing, and I'd love to hear you guys' thoughts on this, so throw it in the chat box, but we're starting to hear of some home care organizations seeing slowdowns in their caseload, families declining visits. At the same time, we're seeing a huge demand being put on the long-term care sector. So if there are home care organizations out there who are looking at a sector slowdown, you have staff who have extra time, instead of reducing their hours, consider getting in touch with us to see if there's an opportunity to redeploy those folks to areas that are experiencing critical shortages. The last piece that I'll touch on before, again, we open it up to questions is just to give you guys all a heads up that we have received the direction from the Ministry of Health to begin canvassing organizations to determine who is working where. And I think this is one issue that came immediately to the forefront with regards to the Lynn Valley Care Center situation, the outbreak there, is that we have staff that are working in multiple locations. And so we have received now the directive from the Ministry of Health to begin collecting that information from our members in terms of where the workers are working so that we can build that database. But with that, I will open it up to questions. I welcome any questions that you guys may have. I want to make sure that we give you ample time to ask those. Not seeing any questions come through as of yet, but please do use the chat box to do that. If you're curious to know, all right, perfect, we got a first one here. So we've got a few that are popping through. So first question is around Is there a location where we can get masks, hand sanitizers, goggles, etc.? We're having trouble finding them at the local store. Yeah, that's a universal challenge right now. What we're finding is that there are some significant disruptions to the supply chain. What I would recommend is if you are in a situation where, again, you're looking at a 3-day supply, get in touch with us. Other options may be looking at some non-conventional suppliers. So for example, in the building supply stores, that's an area where you can sometimes find things like goggles. You can find things like masks because they're used in other industries as well. Hand sanitizer as well. One of the interesting things that we found is dollar stores, believe it or not, appear to have perhaps escaped the cleanup that's happening here. So, and I see there's a few other questions here that are coming up. So again, anybody who has a question around, or if you're looking at a 3-day shortage, all right, you're only having 3 days worth of supplies, please get in touch with us via the info@safecarebc.ca email. See a question here around essential healthcare workers. So the direction that we've received from the Ministry of Health on this one is to take as broad of a definition as possible. Basically, if that person doesn't show up to work, can the show go on? In this case, what we're seeing in the long-term care setting, and just to use that as a parallel, you may determine that your housekeeping staff are essential healthcare workers. Food service workers may be classified as essential healthcare workers. In the home care sector, certainly anyone who's providing direct care. You may also be looking at instances where you have people who are working in a scheduling capacity also being defined to that. So again, the direction we've received is to use as broad of a definition as possible with regards to that. I see a question around if someone gets COVID-19 from an individual who's receiving support, is it a WorkSafe BC claim? That's a great question, and we'll seek clarification on that. So I we'll seek clarification on that particular piece. In general, what we've seen previously is that any infection that was acquired as a result of work can be eligible for a WorkSafe BC claim, but I will clarify with WorkSafe BC on that one to determine. I also see another question here around being told by their employer association that you're not allowed to ask if your staff, if they're working at other places. Yeah, so this was a conversation we just had with the Ministry of Health today, and we've been advised that this is now a directive from the Ministry of Health going forward. And that if our members are seeing pushback, that you are to please notify me so I can escalate it up to the Ministry of Health. They do have other tools in their toolkit, but at this point in time, we're hoping that people will be able to just understand the gravity of the situation and why we need to do this, and take it from there. I recognize that this is going to be a sticky conversation. My email address, by the way, folks, for those who need to get directly in touch with me about these sort of sticky questions, is jlyle@safecarebc.ca. That's JLYLE@safecarebc.ca. Question again about contacting us for supplies. Again, if you're looking at only having a 3 days worth of supplies, the contact is info@safecarebc.ca. That's info@safecarebc.ca. A question now too about personal protective equipment recommendations for working with clients who are deemed low risk. So no suspected or confirmed 19 cases, no symptoms. So if you're in a situation where they are not a suspected or confirmed case, then it's just the usual precautions. And then we have another question here about if there's a positive case at one of our homes, does the CDC come to give us proper PPE directions, or are we expected to have the personal protective equipment on hand? So if you have a positive case in one of your homes, that's a reportable case. So that needs to be reported to the medical health officer for that health region, and they will provide you with the support that's needed. In terms of the personal protective equipment, again, if you're looking at not having the basic supplies on hand right now, please contact info@safecarebc.ca if you do not have those key pieces of equipment I spoke about earlier. So surgical masks, gloves, gown, and goggles. I see a question here around there's uncertainty of the actual virus. There's also uncertainty of business continuation. Heard that measures have been put in place for employees. What about business owners who typically do not contribute to EI? I don't have an answer on that question, but I do know that the federal government has recently announced yet another stimulus package dedicated towards addressing the COVID-19 response. I would encourage you guys to check out the federal government's webpage on that. If you just Google Government of Canada COVID-19, you'll be able to pull up the webpage where they're listing all the EI measures, but also too, there's more measures than that. We've got loan programs for small businesses. There's a number of other things that have been brought forward for small businesses, and I encourage you to check out the Government of Canada's website to get more information on that. I'm just going to take a pause to see if there's any additional questions that are filtering through. And again, I'll just reiterate too, if for whatever reason there's questions that come up after the webinar and you're thinking, gee, I wish I had an opportunity to ask those, you're welcome to either join us again tomorrow for our teleconference or email us at info@safecarebc.ca. So we have another question about staff returning from out of country. The organization deems them as essential, but the union does not and is telling them to self-isolate. So again, we're going to point back to the directive that we've received from the provincial health officer. The provincial health officer has written a letter to the effect stating that healthcare workers are exempted from the 14-day self-isolation measure. There should be additional precautions put in place. So for example, very closely monitoring symptoms, wearing a mask, avoiding close interaction with other staff members, but that is the direction that we've received. And I think it's important that we stay aligned with the provincial health officer's direction at this point in time. Another question around special processes for disposing of the of personal protective equipment in the home. Great question on that one. We'll follow up with you guys directly on that to make sure that we're getting you the right information. I can tell you, generally speaking, in terms of practice, there's some good resources again on our website around infection prevention and control. So I'd encourage you to check out our resources on our webpage on that one, but we will follow up more specifically on that one. Another question here too around statement, make a specific statement about home care and it being essential services. Haven't seen it yet. If they have, can you point it to me? So right now what we've seen is just the pieces around healthcare workers. With regards to home care itself being deemed an essential service, have to get back to you on that one. But again, what we're looking at right now is we're looking at just in particular the language around the 14-day self-isolation piece for healthcare workers. I will also note too that this is something that is evolving on a daily basis. So we're doing our best to keep everybody up to date, but do know that what is true today may be very different tomorrow. A question here about other measures in-home home care providers doing. So for example, streamlining support workers to the minimum number of clients they see, reducing crossover between care community and private in-home clients, etc. I think that's a very prudent measure. I mean, wherever possible, if you can cohort, I think that's a smart move because we want to ensure too that we're not inadvertently spreading a transmission of infection across multiple settings. But again, from a workplace health and safety standpoint, ensuring that we've got folks who are self-monitoring for symptoms, and then they're also, again, they know the infection prevention and control procedures you have in place at your organizations. Got one more question here around someone who's self-isolating. Should we have them provide a doctor's note before returning after the 2 weeks? So the answer is no. That direction has been very clear from the provincial health officers. Please do not send people to a doctor's office if you don't need it. So once somebody's done their 14-day period and they're symptom-free, and this is again assuming somebody has not tested positive for COVID-19. So I'll speak specifically to folks who are just self-isolating. They do not have a positive or a presumptive positive test. They do not need a doctor's note before returning after the 2-week period. If they have received a positive test, right now the practice is that they need to have 2 negative tests consecutively before they can be cleared as being free from infection. So that's just one last piece I want to throw out there. I'm mindful of the time. We can take one more question and then we'll wrap it on up today. But we have, should we be limiting the number of patients that a home care worker is seeing per day, or leaving a certain amount of time in between each visit if they are going from one patient's home to another? So these are all great questions, and this is something that we don't have firm direction on just yet. But that's a question I can certainly take back to the Ministry of Health, because like I said, we are in daily communication with them right now. So in the interests of everybody's time, I want to be very respectful of everybody's time. We're going to wrap up the call today. But again, if we didn't get to a question that you have, I really strongly encourage you to email us at info@safecarebc.ca. That's info@safecarebc.ca. And those questions that we were not able to answer today, we will follow back up with you to provide you with those answers. Thank you again, everybody, for joining us today. Stay safe out there, and please stay in touch.